See what the color of your urine says about your state of health. Urine is a watery liquid produced by the kidneys as part of the filtering process in the blood, where there are eliminated a whole series of waste and toxic elements that are produced in the metabolism and turnover of cells throughout the body. Our body produces from 800 to 2000 milliliters of urine per day. The color of normal urine is yellow, however the intensity can vary depending on what we have ingested or what is happening in the body, as well as there are variations caused by some disease or type of imbalance in the body. Then we will see the different colors that can appear in the urine and what this means in your body. But before we dive in, don't forget to subscribe to our channel and turn on notifications to stay up to date with our updates. Normal color. What is considered the normal color of urine is a liquid with a yellow but clear pigment, almost transparent, without foam or solids of any kind that appear cloudy. This normal color occurs in a healthy and adequately hydrated body. The amount of water as well as the pigments of some foods can cause this standard color to vary. The same can happen with medicines. In theory, the color of your urine varies with food or liquids and food that you consume. However, if despite staying hydrated and not consuming any type of food or medicine with strong pigmentation, the color of your urine varies, it could already be due to other causes that you should take into account, and you should consult your doctor. Let's see. Light yellow color. This is the standard color, indicates that your body is properly hydrated and that you maintain an adequate level of water. If the color becomes lighter than normal, it could indicate that you are consuming more water than your body requires and also be a clear sign that you are losing electrolytes due to the amount of water and work extra filtering that your kidneys are making. Amber yellow color. This color variation is also related to hydration and the amount of water ingested throughout the day. When the color changes to amber, it means that the pigmentation is not well diluted, because the body has not been provided with sufficient water. The color is the product of the decomposition of hemoglobin, which after its metabolism, is transformed into bilirubin, which is a pigment that is partly eliminated through the urine in the form of gold, hence, the yellow color. As you drink water, this color dilutes, that's why your urine often looks darker when you get up in the morning. So in the afternoon, since once your body filters the water, the pigmentation of the urine changes. However, if the amber color remains, it can occur in case of consuming multivitamins with vitamin B and some types of medicines. A red or pink color. Presence of a reddish color in the urine may be due to the pigmentation of some foods such as beets, blackberries, blueberries, or a drink with a lot of dyes or medications. However, the color change due to this type of food is very rare unless its consumption is very high. However, the reddish color can also be due to hematuria, that is, a trace of blood in the urine, which can indicate some type of medical condition such as kidney stones, enlarged prostate, bladder or kidney tumors. 𝗂𝗵𝗆 is another condition that can cause a reddish color in urine. This is a blood condition in which hemoglobin levels are low, even excessively in it. On the other hand, myoglobin can also cause the urine to present a reddish and dark appearance, since it is the expulsion of myoglobin, the protein from the muscles through urine. In any of these cases, you should always go to a medical evaluation in order to determine what these changes are due to and to be able to act in time in the face of any health alteration. Orange color. Urine can present an orange color when you are dehydrated, but also thanks to some type of medications such as antibiotics or medicines to relieve pain. People who are undergoing chemotherapy can also have orange urine, as well as those who take laxatives. Another condition that you should consider if you see that your urine turns orange is the possibility of having jaundice, problems with the ducts or liver because of the possibility that the amount of bilirubin increases in the blood. Some foods can also cause your urine to turn orange, such as eating a lot of carrots, due to the carotene present in these vegetables. Having a high intake of vitamin C can also cause the same effect, although the yellow-orange hue for these reasons is very mild and often goes unnoticed. Brown color. Severe dehydration is the main cause of brown urine color. However, if you know you are well hydrated and the brown color is still present, then it is time to consider other medical conditions and consult your doctor about the presence of a brown color in the urine. It can be a sign of liver disease. It can also indicate hemolytic anemia, which is a type of anemia that occurs when the body mistakenly destroys too many red blood cells. Hemolytic anemia can also be caused by genetic disorders in the blood, such as sickle cell or thalassemia, a type of hereditary anemia in which blood is destroying red blood cells due to a problem in the production of red blood cells. Some medications can also cause brown color in the urine. Among them are antipsychotics, antibiotics such as metronidazole, Medications for epilepsy such as phenytoin. Porphyria is also another cause of dark urine. This is a protein that is responsible for helping hemoglobin to carry oxygen through the bloodstream. However, excess blood of this protein can cause different conditions and require medical treatment. In some cases, porphyria can be chronic. Luckily, it is a very rare condition. Urinary tract infections are another very common cause of dark-colored urine. This is due to bacteria entering the bladder through the urinary tract. Usually, women tend to present more frequently in this type of urinary infections. Another condition that can cause the urine to look dark is hepatitis, a virus that can cause liver damage and change the color of urine. Because the liver has a hard time processing waste from the body, the color of urine can become as dark as the color of a cola drink. Green, for urine, often caused by food coloring medications or some dyes used for medical diagnosis of kidneys or bladder such as indigo blue, indigo carmine, carbolic acid and methylene blue. Another cause of the presence of this color in the urine may be an infection with the bacterium Pseudomonas aeruginosa, a type of opportunistic bacterium that can affect the body in different ways, especially in immunosuppressed organisms, and that also tends to alter the color, making it looks green or blue. Medications that contain phenol and are used to treat allergies and nausea, as well as pain relievers, can cause a green pigmentation in the urine. Some antidepressants such as amitriptyline and cimetidine can also turn urine green as they reduce stomach acids, likewise indomethacin, an anti-inflammatory analgesic used for fever and pain. Some cases such as ulcerative colitis could present this greenish color in the urine, when the intestine, instead of filtering the green dye, absorbs it. Cloudy urine. The cloudy appearance of the urine indicates the presence of some type of solid waste sediment that the body is expelling instead of absorbing it and filter those such as calcium and proteins that not only cause that cloudy appearance but can also make it look white. In other cases, it is due to urinary tract infections, kidney diseases such as kidney stones, or even dehydration. When the urine appears foamy is another reason to go to the doctor, because it could indicate some type of condition or a significant loss of minerals. The smell of urine. Although urine has a characteristic odor, this can change in the event of a disease or infection even before a type of food, asparagus for example. It can cause a smell of rotten cabbage in the urine. Urinary infections can make the smell of your urine stronger or more unpleasant. Another case, in which urine can have a very strong and unpleasant odor, is when you enter ketosis. If you are a follower of the ketogenic diet, this will not be strange to you. And it is not a reason to be scared, because the smell is the product of the expulsion of the areas through urine. When seeing a doctor, in most cases in which the urine changes color, it is necessary to go to a medical evaluation. If it is a simple dehydration, it will only require hydrating your body with a few glasses of water, and the color of your urine will return to normal. However, if it is a severe case of dehydration, it is very likely that you will require intravenous hydration, so medical attention will be urgent and a priority. It is especially important that children or elderly people be taken to the emergency room. If they cannot be hydrated orally, or if they cannot retain liquids due to constant vomiting or evacuations. You should also take into account that the human body usually shows signs of diseases when these have already managed to advance in your system, so without others changes in your urine and after a couple of days these do not return to normal, it is better that you go to the doctor, because only then can you check if you are facing a more complicated health situation and be able to start the appropriate treatment. Urinary infections are usually frequent in the body, but if they are not treated, can spread to the kidneys and complicate your health. If you are one of the people who replace water with other drinks such as soda, sports drinks or alcohol, you should be even more careful, because your body is being forced to work twice as hard, since it must process each of these liquids to extract the water and discard the rest, which can cause serious kidney problems. Water is always the best option to replenish your fluids. If you pay close attention to almost all the indicators that we have mentioned about urine color changes, the most common cause in all of them is dehydration. So that is why you should be twice as careful, because even if you think you are hydrated, it may be that you really are not. We hope that this video was helpful. If you have anything to add, please share it with us in the comments. Like this video and send the link to your family and your best friends, so they also know about urine color indicators. If you are new to our channel, do not forget to subscribe.